Hi friends, it's Jessie again. I'm just coming to you to help you get a little home remedy to treat mastitis. Along with nursing comes some goods and bads every time. Not all women will get mastitis, but sometimes it happens, sometimes it doesn't. More times than not, it happens within the first 3 months of nursing. A lot of women will get just really tender breast tissue, really sensitive, and they'll sometimes get a fever. They'll get lots of symptoms that they don't really know what's going on. Sometimes they don't even know that they're having the mastitis. The fever will start first and the body aches. But if you are having those symptoms, I would recommend seeing your physician and seeing if that is the diagnosis or not. You don't always have to. If you want to just treat it without seeing the physician, that's up to you. But what I would recommend to do if you are diagnosed with that is I would recommend taking basil oil, frankincense oil. You all know I love frankincense oil, and an On Guard blend. On Guard blend is a good protective blend, just also an immune booster. You're going to take 1 to 2 drops of each of these oils, and you're going to mix them in your hand. And you can, I would suggest using a carrier oil also, and rubbing that around your breast tissue every hour for the first day. You're gonna wanna do that because once you get full-blown mastitis, I had it once and I never want it again, you're gonna wanna really take care of that. It does take a lot of more repetition than just popping an antibiotic or a cream. But if you want to do it the natural way, this is how you can do it. So take 1 to 2 drops of each oil, like I said, On Guard, frankincense, and basil, and do it every hour for the first day. For the second day, I would do it every 2 hours. And then if you feel like on the third day that you still need to keep applying, then I would do it every 3 to 4 hours. And just regulate that how you're feeling. I would keep doing it for the day after that you feel good, just so that you get whatever is left. Like I said in my previous videos about nursing, just avoid your nipple area because you just don't want to irritate the baby in any way or make them have a bad flavor. So you can do that, or you can also, like I said in my other nursing videos, you can use the roller ball and you can just times that recipe by 5 or 6. And add those oils and then just fill the rest with a carrier oil, and then you can just apply that. That might be a little bit easier and less time consuming to do every time, and then you won't have to wash your hands before touching your baby every time. You can either do that, or you can keep the same recipe that I gave you at the first, and you can put it in these little capsules that I recommended a couple times. So see, it's kind of like a gel cap that you take with anything else. You can buy them at the health food store. You just put your oils in the big part. There's a big part and a little part. Put them in the big part, and then you just put on the top, snap it down on, and then you can just swallow that. They have veggie caps or just the normal caps, depending on if you're vegan or not. And I get these at the health food store. I found the best deal at a Whole Foods store. I get the 0.0 size. They have different sizes on the shelf, but this is the 0.0 size. It's not like the horse pills that you have to take sometimes when you've taken a strong antibiotic. But it's pretty general size that you can fit as many drops as you usually need for most conditions and most things that you're treating. Other than that, let me read my notes. Oh, one thing I want to stress. A lot of times when I recommend using oils, I'll say use a hot compress after on the area that you're applying it to help spread and absorb those oils quickly and deeper. But for mastitis, do not use the hot compress on your breast tissue after applying the oils. It will help the infection spread. So do not do that for that. Also, just a side note from the mastitis, that's a little lesser condition of it. It's not mastitis, but when you get those sore cracked nipples, I would suggest looking at my video for diaper cream. That cream that I have the recipe on there to make is wonderful for a nipple cream. The lavender, the helichrysum, and the Roman chamomile are wonderful to help soothe the skin and to heal it and repair it. A lot of times when the babies are sucking and when they're not sucking, your nipple tissue will have cracks and it can get bacteria, and it can kind of fester and really get sore and really hurt. And make it so it's miserable to nurse. And you don't want that. It's the last thing that you want to do when you want to nurse your baby. So you can get that cream, and that cream will not irritate the baby in any way. Like I said, the taste might be a little bit different, so you might want to do it every time after nursing. Just apply that cream, and then before nursing, just wipe the nipple clean, and then let the baby nurse and apply it every time after nursing. If you have any questions, leave them in the comments below, and I will get back to you as soon as I can. Thanks, guys. Bye.